virus and any measures to stop it from day one. That divisiveness combined with these more contagious variants have contributed to where we are today, making headlines for skyrocketing cases and hospitalizations. It's not a surprise that some of our neighbors choose to attend maskless rallies when elected officials like Senate Majority Leader Mike Shirkey and others attend and legitimize those rallies. It's not a surprise when parents in Hudsonville start banging on the doors at a school board meeting to protest their kids having to wear masks, when many Republican lawmakers won't even wear masks at work in the Capitol building. Attitude reflects leadership. We should expect more from our leaders. Don't get me wrong, we're all tired of this pandemic, of having to wear masks, of not being able to attend events with our loved ones. But that's all the more reason for us to do the right thing now to end it. We're in a race between the vaccines and the variants, which could continue to mutate to a point where the current vaccines are ineffective. Republican leaders can help us end this pandemic by encouraging our neighbors to get vaccinated and to do what else we know works to stop the spread until we reach herd immunity. I don't want to have to sign another death certificate for COVID-19. Thank you. I'd like to introduce my colleague, Dr. Jayashriya, to speak now.
Thanks, Jan. So my name is Dr. Hershey Jayasuriya, and I'm a family physician practicing in Greater Lansing and the CEO of Bridge Care Specialists in Michigan, a virtual clinic that works to help prevent 30-day readmissions back to the hospital. We've seen our fair share of COVID discharges and can say that Michigan is in a bad spot right now. We're at the top of the pack when it comes to the more contagious B117 or UK variant cases. Many hospitals are at full capacity, and many are seeing severe cases of COVID-19 in our younger patients and children now. It's true with my work with Bridge Care that we're seeing younger and younger patients on oxygen as they're leaving the hospital, and it is a bit disheartening, but it's not all doom and gloom. The vaccines really do offer us a way out if enough of us get it. Our state of Michigan just hit 6 million doses administered this week. Unfortunately, we're getting to the point where supply of vaccines may outstrip demand. Demand seems to be fairly low among conservatives, and that threatens their safety and that of their communities. But some are speaking out in favor of vaccinations. After a maskless meeting of the 6th Congressional District Republicans resulted in a COVID-19 outbreak, leaders advocated for the vaccine. Chairman Scott McGraw lost his father to COVID-19 and had been vaccinated before the outbreak. He said, "I am kind of pushing people to get the vaccine. That's probably not the most popular conservative Republican stance, but I can testify that it helped me out." Republican leaders like him who are calling for people to get vaccinated and to wear masks deserve credit for the courage of encouraging others to do the right thing. Republican leaders have an opportunity to lead by example, get vaccinated, and tell people that they did so, like the treasurer of the 6th Congressional District did as well after the dangerous outbreak. And frankly, as former President Trump himself has done when he said, "I would recommend it," Republican Tommy Brand from Grand Rapids even supported a statewide requirement to wear masks. So instead of protesting COVID-19 precautions and making hay about masks, Republican legislators and conservatives can indeed do the right thing. And the right thing from a factful and evidence-based perspective is to get vaccinated and wear a mask until we reach herd immunity. I'd like now to introduce Dr. Rob Davidson to speak.
Thank you so much, and thanks everyone for being here. I'm Rob Davidson. I'm an emergency physician in West Michigan for the past 20 years. I'm also the executive director of the Committee to Protect Medicare. Like my colleagues here and my colleagues across the state, I witnessed the severity of the situation our state is in every single day. I'll just say I've worked a bunch of shifts the last few weeks. I've worked 10 out of the last 13 shifts, and it is crazy at our hospital. Nearly every other patient in recent shifts has come in with concerning COVID-19 symptoms, most of them testing positive. I'd say at least 2/3. I had to rush up to the ICU to intubate a younger patient in their 50s who hadn't gotten vaccinated and had expressed that they didn't want to get vaccinated. They thought it wasn't such a big deal, but they were on maximal support with non-invasive oxygen, and it was determined they had to be put on a ventilator, and it was an urgent situation. I had to run up from the ER to do that. And So even though everyone's tired of this and we feel like there's this light at the end of the tunnel, the people who come in with this disease are still extremely sick. So as I see sick people in my ER every shift, I can say for sure that now is not the time for divisiveness, misinformation, or dangerous protests. Now is the time for leaders to show that they're committed to helping their constituents do the right thing and stay safe until we get to community immunity, or what a lot of people call herd immunity. Now is the time for those of us in positions of leadership and influence to let our communities know that all of the vaccines are 100% effective at protecting people from severe illness that can lead to hospitalizations and death. As doctors, we all took an oath to care for people, and we're doing everything we can to encourage people to get vaccinated. I will say my wife is a family physician, and in her inbox every day, her messages, she has patients asking her questions about the vaccine. Is it safe? And every single one, she tells them they're safe, they're effective. Myself, my wife are vaccinated. Our teenage son just got vaccinated. We're waiting for our 15-year-old daughter to get vaccinated when it's okay. Our 20-year-old daughter, I mean, we are giving this vaccine to the people we love most in the world. And this is what we tell people. Every patient I talk to, I ask them, have you been vaccinated? Do you plan to be vaccinated? And those that say they don't, or they're not sure, we have some time and we have a conversation. And I explain to them my thoughts on the safety, the effectiveness, and the absolute necessity for our small West Michigan community and for our state so that we all get vaccinated. But we do need help from other trusted leaders, including our lawmakers in Lansing, to help get us there. By choosing to get vaccinated, Michiganders can protect their own health and the health of their family and loved ones and finally get us back to normal. Thanks, and I think we can take questions now.
Yes, thank you, Dr. Davidson. We are now taking questions. If you have a question for one or any of the doctors, please feel free to ask it now. You can raise your hand and I can unmute you. You can also use the chat function or the Q&A function. So whichever of those three methods works best. We'll give a few minutes for folks to be able to utilize those. Okay, we have a question from Jonathan. You should be able to talk now.
Great, yeah, thanks. I have sort of a tangentially related question for a policy story I'm working on. House Republicans are moving to ban the use or development of vaccine passports, at least at the governmental or university level. I'm wondering if any of the medical professionals on the Zoom today have any thoughts on that policy proposal.
I'm off mute, so I can take a stab at that. Listen, I think certainly private industry should have the right to say to their employees, this is a serious disease. We want to protect everyone in our employment, and so we require you to be vaccinated. I think universities should have the right to do that, particularly because we are putting all of these young people in these congregate living situations. It is just a recipe for massive outbreaks, particularly if folks, are not behaving smartly, are not socially distancing, are not wearing masks. I just think we're going to see ourselves go through this cycle and have another outbreak in the fall. So I would encourage them to really think hard about what they are doing if they try to ban such a practice. I think in addition to the mixed messages or bad messaging on behavior, I think they're just inviting our state to be the kind of the ground zero for outbreaks to come in the future.
Thanks.
And that's not to say that Dr. Davidson or I or anyone else doesn't understand and appreciate the equity concerns. We of course do. And that's why we're working so hard every day to get this vaccine into as many arms as possible, including the arms of vulnerable populations across the state. Because the last thing that we want, any of us, is to exclude already vulnerable populations from being able to participate in civil society. That's not the point. But the point is, what's most important right now for public health is that we immunize as many people as possible. And if those people who choose to be unvaccinated decide that they want to congregate in large numbers, we know that's going to lead to more outbreaks. And so private industry and universities ought to have the right to make the decisions that are best for themselves to protect their congregants.
Thanks.
To add to that, I would say that at this point, I feel like it's the most patriotic thing to do is to be vaccinated, simply because if we want the country to go back to how it had been functioning as a capitalistic country. Everybody's working, we're still generating economy and such. For us to get vaccinated, that's the only way out of this. And so for legislators to try to prevent that, to me, just feels like some going against what we're trying to achieve as getting the country back online. So, yeah.
There's a strong irony here between what they desire. They desire a free society versus what they're not doing, which is the way to get to the free society that they want is the immunizations that they're pushing so hard against. So that's the strong irony to me, is if we all share the same goal of going back to how we were living in 2019, but the way to get there is to get the vaccine into as many arms as possible instead of pushing back against them.
Thanks for that question, Jonathan. We do have time for more questions too, and I see Michaela has raised her hand. I will unmute you now.
Hi, thank you so much for taking my question. Going into this maskless march tomorrow, can you just kind of reiterate why masks are important and what the data has shown about them working throughout the pandemic?
I can just say I don't have the exact studies, but there's strong epidemiologic data in places, counties in particular, and states where mask mandates have been implemented, showing decreased transmission, right? Decreased case numbers. It's strong. I think everyone has seen the occasional video pop up on Facebook with somebody with some kind of smoke or steam showing it escaping from masks. These are just non-scientific based anecdotes of what people think masks do or don't do. But the most important data is the epidemiologic data that shows when those mandates are in place, we have less transmission. So I'm still sort of blown away when I see 2-year-olds walking around with masks on, not having any problem, and why it has become such just such a challenge for people to want to do this. I think we all know it was politicized and continues to be so. I don't understand why that continues. It seems like just such an easy thing to do. But anyway, yeah, the data is there. The data is strong. And on top of that, it is simple. It has zero harm. And so it seems like a no-brainer.
Yeah, I think the biggest pushback that I get from patients is, well, it's not 100%. Well, nothing in life is 100%. It's definitely more than 95%. So I like my chances a whole lot better wearing a mask than not. And so I encourage patients, yes, you still could get COVID if you're not wearing a proper N95 mask. If you're wearing a simple mask, it's still possible to transmit it and get it, but certainly much, much less likely for that to happen than if you go unprotected without a mask at all. And that's really the bottom line. And I share the frustration that we're still talking about this an entire year later, that we're still debating the effectiveness of simple things like masks.
Thank you, Michaela. Rachel, I will unmute you now.
Yeah, hi everyone. Thanks for taking my question. When you do speak with your patients, are you finding that they're taking their lead from politicians, or are they taking their lead from things like, sorry, my dog is in the background, but are they taking things from like Facebook? Are they taking things from other people? So is this why you're calling out Republican leaders specifically?
I'd like to tackle this one to start with here. I feel like we're challenged with arguing against a narrative that's emotionally based. And it's hard to argue emotion, with facts. And that becomes really the uphill battle that we're struggling with, is they're getting an emotional reaction to non-scientific information, because science at a baseline should not be emotional. If there's emotion involved in a decision, then it's no longer, in my opinion, true science. It should be something you have to decide between one fact versus the other. And a lot of the information, unfortunately, that's out to the public, the sludge that's left for the public to filter through, is truly sludge. It's just things that have been reprocessed and reprogrammed and spun, through social media, and has a lot of diversiveness to it. So, yeah, I think that is a big challenge when you're arguing a narrative that somebody has in their mind. the question is, what narrative is that, and how do we start to unbunk that narrative? And that's definitely a challenge, when you feel that people are going against science because they think it's, coming against them. That's a tough one to then argue with science. So, yeah.
But it's
Yeah, and I don't specifically ask, hey, who did you hear that from? Was that Facebook? Was that, someone you went to high school with? Was that former President Trump? Was that whoever? But I've recently, in the past few weeks, had people not want to wear masks and then express frustration saying, well, this isn't that big deal. This is just a flu. That this is blown out of proportion. Had someone absolutely fighting not to get a COVID test on their kid they brought in with classic symptoms because they said, well, this is all made up. A colleague of mine had someone who was positive, who was sick enough to be admitted, and their family member said, oh, well, you must have given that to her because we know it's not real. I don't know where they're getting this, but we do know where this kind of information is being spread, and it's videos being shared on Facebook in groups. It's comments all across last year from former President Trump and others, and so I guess their specific route of getting this information is probably less important than the fact that it's just out there and it's been shared and reshared, and it's hard to push back against.
In the most recent statistics, it's still the case that 40% at least of Republicans nationwide in survey data are saying that they're never going to get the vaccine ever. And that number is actually increasing. So that's why we're calling out Republicans specifically, because they helped create the psychology, the mindset amongst their followers that this isn't a big deal. And it started with President Trump. And instead of admitting that they were wrong about how severe COVID was going to become, they've doubled down on this idea that it's not that big of a deal. And so that's what we're up against is the patients who I'm struggling to vaccinate every day are typically the ones who look up to Donald Trump and look up to Mike Shirkey and look up to Republican leaders, and they take their cues from them, whether it's Facebook or Twitter or otherwise. They parrot the talking points that they hear on Tucker Carlson's show or on Sean Hannity's show, and all of the above. And so if we can get more Republican leaders to say, all right, guys, yes, we were wrong. This is a big deal. This is serious, but we can get past this. Here's what you need to do. Some trusted Republican voices is all we need to help us get through to the finish line.
Great question. Thank you. We do have time for more questions if anyone has them. I'm also going to drop my email address in the chat box if you have any follow-up questions or want a copy of the recording. Please feel free to follow up with me. Yeah, I'm not seeing any other questions come in. So thank you everyone for attending and covering this very important issue, asking great questions. And thank you, of course, to the 4 doctors for taking time out of your busy days to lend your expertise and really communicate well on this really important topic. So thank you.